Most men over 70 believe they know everything about their own bodies, especially when it comes to private matters. They think certain habits are harmless or simply a normal part of aging. But what if I told you that some seemingly innocent and very private acts, often performed in solitude, could be silently sabotaging your health, your peace of mind, and even your most intimate relationships without you ever realizing it? I am Dr. Benjamin Carter, a urologist and men's health expert with over 2 decades of experience, dedicated to helping men like you navigate the complexities of aging with strength, dignity, and vitality. Today, we're going to dive into a topic that's often whispered about, if discussed at all: masturbation. Specifically, we'll uncover 4 critical mistakes men over 70 frequently overlook in this very personal area, and the significant, often hidden price they pay. My goal is to shed light on these blind spots, not to judge, but to empower you with knowledge that can dramatically improve your physical and emotional well-being. I'm about to reveal insights that go far beyond what you might expect, delving into the intricate connections between your private practices and your overall health. And make sure you stay with me until the very end, because I'll uncover one specific, deeply ingrained mindset, often passed down through generations, that is perhaps the most damaging mistake of all, quietly undermining your sense of self-worth and your ability to experience true intimacy as you age. This revelation could be the key to unlocking a profound shift in your approach to your own well-being. If you're ready to gain a deeper understanding of your body, challenge old assumptions, and reclaim a healthier, more confident future, please take a moment to subscribe to this channel and hit the notification bell. Your engagement helps us reach more men who need this vital information. And if any of what I share today resonates with you, let me know in the comments below. Your journey towards better health is a shared one. Let's begin by addressing the physiological and emotional impacts of these often overlooked mistakes. The first common pitfall for men over 70 when it comes to masturbation is excessive frequency or intensity, leading to undue stress on the body. As men mature, the delicate tissues of the penis, the intricate network of nerves, and the vascular system become more vulnerable. With age, the elasticity of blood vessels can decrease, and nerve endings may become less sensitive. When masturbation becomes overly frequent or intensely vigorous, it can introduce microtrauma to the penile tissue. This isn't always immediately apparent, but over time, it can contribute to a cascade of issues. Imagine the constant, repetitive strain on delicate structures. The tunica albuginea, which encases the erectile tissue, can experience tiny tears. This can, in rare cases, contribute to the development or exacerbation of conditions like Peyronie's disease, where fibrous scar tissue forms, leading to curvature, pain, and even erectile dysfunction. Beyond the penis itself, frequent, intense pelvic floor contractions can strain the muscles surrounding the prostate and bladder, potentially contributing to conditions like chronic pelvic pain syndrome or even exacerbating existing urinary symptoms associated with an enlarged prostate, or BPH. The constant demand on the vascular system can also be taxing, potentially affecting the smooth muscle function necessary for robust erections. Emotionally, this often stems from a misplaced belief rooted in the use it or lose it mentality, which, while having some truth in general physiological maintenance, can be taken to an unhealthy extreme in this context. Men might feel a compulsive need to prove their continued virility, even to themselves, by engaging in masturbation excessively. This can lead to a cycle of anxiety and shame. If issues like pain or reduced sensitivity arise, the man might blame himself, internalizing these physical changes as personal failings rather than physiological consequences. This secret struggle can foster a sense of isolation, preventing open discussion with a partner or medical professional, and further eroding self-esteem. Consider Arthur, a man of 76, a retired engineer who came to me with concerns about persistent penile discomfort and a noticeable decline in erectile function, even during his solo activities. He was a disciplined man, accustomed to applying a more is better philosophy to most aspects of his life. He believed that to maintain his machinery, he needed to engage daily, sometimes multiple times a day, with considerable vigor. Arthur sheepishly admitted he'd been using a technique he'd developed decades ago, one that involved significant pressure. The physical toll was evident. His penis showed signs of mild inflammation, and his reports of discomfort were consistent with tissue strain. But the emotional impact was just as profound. He felt a deep sense of failure, questioning his virility and fearing he was wearing out his body. We talked about how his intense, almost compulsive routine, born from a desire to maintain function, was actually causing physical strain and a quiet despair, rather than the vitality he sought. His narrative reflected a common societal pressure, the unspoken expectation for men to maintain peak sexual function indefinitely, leading some to overcompensate in private. To counteract the physical and emotional strain of excessive frequency or intensity, the solution is rooted in moderation and mindful technique. For the physical aspect, I advise men to reduce the frequency of masturbation, allowing adequate time for tissues to recover and regenerate. Instead of daily, consider every other day or even 2 to 3 times a week, depending on your individual needs and body's response. Crucially, focus on a gentler approach. Avoid harsh friction or excessive pressure. Use ample, high-quality, water-based lubricant to minimize irritation. Think of it as a quality over quantity approach. Instead of a rapid, intense session, slow down, focus on sensation, and allow for a more relaxed experience. This not only protects delicate tissues, but can also enhance the pleasurable experience by allowing nerves to respond more fully without being overwhelmed. If you experience pain or persistent discomfort, immediately reduce frequency and intensity. For the emotional and psychological aspects, challenge the more is better paradigm. Understand that sexual health for men over 70 is about overall well-being and quality of intimacy, not just frequency of orgasm. Engage in self-compassion. Acknowledge that your body is changing, and that's a natural part of life. These changes do not diminish your worth or your masculinity. Focus on the emotional satisfaction and stress relief that a healthy sexual outlet provides, rather than viewing it as a performance metric. This shift in mindset can alleviate anxiety and transform a potentially damaging habit into a source of gentle pleasure and self-care. Now, let's turn to the second significant mistake: ignoring pain or discomfort during masturbation. This seems obvious, yet countless men, especially those over 70, are prone to this. Physiologically, pain is your body's alarm system. When it arises during masturbation, it is never something to ignore. It could be a signal of a range of underlying urological conditions that demand attention. It might be an indicator of prostatitis, an inflammation of the prostate gland, which can cause discomfort in the pelvic area, groin, or even during ejaculation. It could point to a urinary tract infection, or even a sexually transmitted infection. Yes, even at 70 and beyond, if you're sexually active with multiple partners. More seriously, it could be a sign of urethral stricture, a narrowing of the urethra that can make ejaculation painful, or even a nascent Peyronie's disease, where scar tissue formation can cause a painful bend in the penis, often first noticed during erection or manipulation. Delaying attention to such symptoms can lead to the progression of these conditions, making them harder to treat, or masking more serious issues like early-stage cancers that might be causing subtle discomfort. The body's intricate systems are interconnected, and a seemingly isolated pain can be a symptom of a larger systemic imbalance. Emotionally, the act of ignoring pain often stems from a deep-seated stoicism or a fear of vulnerability. Men are conditioned from a young age to tough it out, to dismiss discomfort as minor or temporary. For men over 70, there's an added layer, a reluctance to admit to any perceived decline in their physical capabilities, especially in such a private and symbolically potent area. The fear of what the pain might mean, a serious illness, the end of their sexual life, or simply the acknowledgement of aging, can lead to active avoidance. This denial can create immense internal pressure, leading to anxiety, frustration, and a pervasive sense of dread. It can also isolate them from their partners or doctors, as they are too embarrassed or ashamed to voice their concerns. This emotional burden is often far heavier than the physical discomfort itself. I vividly recall Charles, a man in his early 80s, a proud former Marine. He visited me for what he described as just a little discomfort during masturbation. For months, it had been more than a little discomfort. It was a sharp, burning pain, sometimes accompanied by a discharge. He had dismissed it, telling himself it was just an old man's aches. His wife, concerned by his increasingly withdrawn demeanor, had finally pushed him to seek help. We discovered he had a severe, untreated prostate infection that had spread, causing significant inflammation and discomfort. His stoicism, a trait he had prided himself on throughout his life, had led him to endure months of unnecessary pain and put his health at risk. For Charles, admitting the pain felt like admitting weakness, a betrayal of his lifelong persona. The societal narrative of masculinity often pressures men to suppress physical complaints, perpetuating a dangerous cycle of delayed diagnosis and worsened conditions. The solution to ignoring pain is straightforward yet profoundly impactful: radical self-awareness and immediate medical consultation. First, cultivate a heightened awareness of your body. Pay attention to any new or persistent sensations during and after masturbation. Is it a dull ache, a sharp pain, a burning sensation? Is there any change in texture or appearance? Do not rationalize or dismiss it. Second, and most importantly, promptly schedule an appointment with a urologist or your primary care physician. Be completely honest and open about your symptoms, no matter how embarrassing they may seem. Remember, we as doctors have heard it all, and our priority is your health and well-being, not judgment. Early diagnosis and treatment are crucial. For Charles, addressing his infection brought immense relief, not just physically but emotionally. He realized that true strength lies not in enduring pain silently, but in proactively seeking help. This proactive approach can prevent minor issues from becoming major problems, preserving your comfort, your function, and your peace of mind. Our third crucial mistake, particularly relevant for men over 70, is over-reliance on masturbation as the sole or primary form of sexual expression and intimacy. Physiologically, an over-reliance on masturbation, especially with a very specific technique, can inadvertently lead to masturbatory ED or conditioned erectile dysfunction. This occurs when the brain and body become so accustomed to a particular form of stimulation, perhaps a certain grip, pressure, or visual input, that they struggle to achieve or maintain an erection with a partner under different circumstances. The neurological pathways become specialized, making it difficult to respond to the nuanced, variable stimuli of partnered intimacy. This isn't a physical inability to get an erection, but rather a learned response that limits the ability to perform outside of specific, self-induced conditions. It's a form of desensitization to the broader, often less intense, range of touch and sensation inherent in partnered sex. This can create a feedback loop where frustration with partnered sex leads to more reliance on masturbation, further reinforcing the problem. Emotionally, this mistake carries a heavy price. While masturbation is a healthy and normal part of male sexuality, when it becomes the only outlet, it can foster a profound sense of isolation and detachment. Intimacy, especially in long-term relationships, is about connection, shared experience, vulnerability, and mutual pleasure. If one partner consistently retreats to solo sexual activity, it can create a void in the relationship. This can lead to feelings of loneliness, inadequacy, and a diminished sense of self-worth. Men might feel ashamed of their inability to perform with a partner, or resentful of their partner's perceived expectations, further withdrawing. For those without partners, exclusive reliance on masturbation can prevent them from exploring new intimate connections, as it fulfills a need without the complexities or vulnerability of shared human experience. This can deepen feelings of isolation and reduce opportunities for emotional growth and connection, which are vital for mental well-being in later life. Edward, a distinguished 72-year-old, a widower for 5 years, came to me seeking advice on his declining libido. Through our conversations, it became clear that while he was still sexually active through masturbation, he felt increasingly disconnected from others. He had a lovely lady friend he cared deeply for, but whenever intimacy progressed, he found himself unable to achieve an erection. This was profoundly embarrassing and confusing for him, as he had no trouble when alone. He confessed to a routine that involved specific visual stimuli and a very firm grip, which had become his comfort and his primary sexual outlet after his wife's passing. The problem was not his body's capacity for erection, but its conditioned response. He felt an intense loneliness, despite his sexual activity, because he was missing the profound emotional connection that partnered intimacy provides. His story underscores a societal challenge, the evolving landscape of intimacy for older adults. There's often a lack of understanding or open dialogue about how sexual needs and expressions change with age, and how to maintain connection beyond traditional intercourse. The solution to over-reliance on masturbation as the sole sexual outlet is to consciously broaden your definition of intimacy and actively re-engage with your partner or seek new forms of connection. Physiologically, if you're experiencing conditioned AD, the first step is to reduce or temporarily cease your specific masturbatory technique. This allows your brain and body to reset and become more responsive to different forms of stimulation. Experiment with gentle, varied touch with your partner, focusing on non-penetrative intimacy, kissing, caressing, and sensual exploration. This helps to resensitize your body to the less intense, but deeply connective, forms of arousal associated with partnered sex. Consider using different lubricants or even blindfolding yourself during partnered sex to reduce the visual dependence that might be tied to your masturbatory habits. Emotionally, the journey is about rekindling connection. Have open, honest conversations with your partner about your desires, your fears, and your changing bodies. Explore intimacy beyond intercourse. Shared activities, deep conversations, holding hands, and simply being present with one another. For single men, this means being open to forming new, meaningful relationships, understanding that sexual connection can be a part of a broader, emotionally rich bond. Remember, intimacy is a spectrum, and sexual expression is just one part of it. Embracing this broader view can lead to a more fulfilling and less isolated existence, deepening your connections and enhancing your overall well-being. Edward, with consistent effort and a renewed focus on non-penetrative intimacy with his friend, slowly retrained his responses, finding not just physical pleasure, but a profound emotional closeness he had sorely missed. Finally, we arrive at the fourth mistake: using inappropriate lubricants or devices or neglecting personal hygiene. This may seem minor, but its impact can be significant. Physiologically, the consequences of using inappropriate substances as lubricants are varied and often irritating. Petroleum jelly, common household oils like olive oil or cooking oil, or even hand lotions are not designed for intimate use. They can clog pores, irritate sensitive penile skin and urethral opening, leading to rashes, itching, inflammation, balanitis, or even bacterial and fungal infections. These substances are also notoriously difficult to wash off, leading to a buildup that can further irritate the skin. Furthermore, some can degrade the integrity of latex condoms if partnered sex is involved, increasing the risk of STIs or unintended pregnancies. Similarly, certain devices, if not cleaned properly or if made from porous materials, can harbor bacteria and become sources of recurrent infections. Neglecting general hygiene, such as not cleaning the penis regularly, especially under the foreskin if uncircumcised, can lead to smegma buildup, odor, irritation, and increased risk of local infections or inflammation. Over time, chronic inflammation can even contribute to more serious issues, though this is rare. The goal is to maintain a healthy, balanced microbial environment to prevent irritation and infection. Emotionally, discomfort, itching, or odor from poor hygiene or inappropriate products can lead to significant self-consciousness and embarrassment. A man might become withdrawn, avoid intimacy, or feel a deep sense of shame about his body. This can erode self-confidence, creating a barrier to both solo pleasure and partnered intimacy. The fear of infection, the constant discomfort, or the perceived uncleanliness can profoundly impact a man's self-perception and his ability to feel comfortable in his own skin, leading to a diminished quality of life. The very act meant for pleasure can become a source of physical and emotional distress. I recall Frank, a gentle 78-year-old who came to me with persistent itching and redness around his penis. He was deeply embarrassed, admitting that for years he had used common petroleum jelly as a lubricant, believing it was harmless. His reasoning was simple: it was cheap and readily available. He also confessed that, due to mobility issues, his personal hygiene had sometimes slipped. We found he had a severe fungal infection, exacerbated by the occlusive nature of the petroleum jelly and inadequate cleaning. Frank's story highlights a lack of readily available, practical information about intimate hygiene and product selection for older men. There's a pervasive societal silence around these practical details, leaving men to rely on outdated knowledge or guesswork, often leading to unintended negative consequences. The solution here is straightforward. Prioritize proper hygiene and use only high-quality, water-based lubricants. Physiologically, always use a lubricant specifically designed for intimate use. Water-based lubricants are ideal as they are non-irritating, easy to clean, and compatible with all types of skin and devices. Avoid anything oil-based. When it comes to hygiene, make it a non-negotiable part of your daily routine. Clean the penis gently with mild soap and water, especially under the foreskin if applicable. Ensure it is thoroughly dried to prevent moisture buildup. If you use any devices, clean them immediately after use with soap and water and allow them to air dry completely. Store them in a clean, dry place. Emotionally, by taking these simple, proactive steps, you eliminate a significant source of physical discomfort and emotional embarrassment. This empowers you to feel clean, confident, and comfortable in your own body, enhancing your overall sense of well-being and making any form of sexual activity, solo or partnered, a more enjoyable and healthy experience. Frank, once his infection cleared and he adopted a consistent routine with appropriate products, expressed immense relief, not just from the itching, but from the crushing shame he had been carrying. You see, with just a few mindful adjustments to these private habits, many of my patients report a profound transformation. They experience a significant reduction in discomfort, improved erectile function, and a renewed sense of confidence. This isn't just about preventing physical ailments. It's about reclaiming your autonomy, your dignity, and your rightful place as a man who can experience pleasure and intimacy well into his later years. You're not merely managing symptoms. You're actively building a healthier, more fulfilling future. The changes you embrace today will ripple through every aspect of your life, from your physical comfort to your emotional peace. But there's one more surprising, yet incredibly common mistake that underpins many of the issues we've discussed, quietly affecting your sexual health, your emotional well-being, and your overall quality of life as you age. It's something most men over 70 never even consider, and yet it might be the very reason you're experiencing a disconnect between your desires and your reality. This ultimate mistake is the pervasive belief that a man's worth and identity are inextricably linked to his sexual performance and perceived virility. This isn't about masturbation techniques or product choices. It's about a deeply ingrained cultural narrative that often tells men, implicitly or explicitly, that as their sexual capacity changes with age, so too does their value as a man. Physiologically, this constant internal pressure and anxiety can lead to performance anxiety, which is a major contributor to erectile dysfunction. The stress response itself can constrict blood vessels, release cortisol, and inhibit the very neurological pathways necessary for sexual function. Emotionally, this belief is devastating. It fosters a relentless self-criticism, a fear of judgment, and a profound sense of loss as bodies naturally change. Men may become obsessed with maintaining a youthful sexual prowess, leading to the excessive behaviors we discussed earlier, or they may withdraw entirely, feeling inadequate and unseen. This mindset prevents them from embracing the rich, multifaceted forms of intimacy available in later life, and often leads to a quiet despair, a feeling that their best years are behind them, simply because their sexual expression has evolved. It makes men fear the natural process of aging, transforming what should be a journey of wisdom and new experiences into a battle against an inevitable tide. It's the ultimate hidden mistake because it colors every perception of sexual health, making men susceptible to self-damaging behaviors and emotional distress, all while striving for an outdated ideal. This pervasive cultural narrative that equates masculinity with unchanging sexual prowess needs to be dismantled. True male vitality in later life is found not in a relentless pursuit of youthful performance, but in embracing the full spectrum of well-being. Physical health, emotional intelligence, meaningful relationships, intellectual curiosity, and a sense of purpose. When you let go of the rigid expectation that your worth is tied to your sexual function, you free yourself from immense pressure. You open yourself to a richer, more authentic life. You understand that your body's capabilities will naturally evolve, and that's okay. Your value as a human being, as a partner, as a friend, and as an individual transcends any single physical attribute. This allows you to engage in sexual expression from a place of genuine desire and connection, rather than obligation or anxiety. It empowers you to redefine intimacy on your own terms, embracing tenderness, companionship, and shared experiences as equally, if not more, valuable than any specific physical act. This profound shift in mindset can lead to a liberation you might not have thought possible, allowing you to age not just with health, but with true joy and self-acceptance. If this discussion has helped you understand your body better and empowered you with new strategies for a healthier and more fulfilling life, please share it with another man who desperately needs to hear this message. Let's break the silence surrounding men's health together. Your health journey is a shared one, and by engaging, you empower not just yourself, but countless others. Don't forget to subscribe to my channel, because I'll be sharing more doctor-backed advice made especially for men like you. Leave a comment below and let me know which of these insights resonated most with you, or if you have a question. I read every comment, and I'm here to support you every step of the way. You've taken the first crucial step towards reclaiming your vitality and confidence. Now keep going. Your best years are still ahead, and you absolutely deserve every one of them to be full of health, strength, profound satisfaction, and a deep, abiding sense of your own inherent worth.